On behalf of East Hudson Oral and Maxillofacial Surgery, we want to welcome you to our presentation. Here we will discuss the oral sleep appliance, how our office operates in the treatment of obstructive sleep apnea, and the professional relationship that you can have with dentists in your community. So let's dive right into it and show you here what the oral sleep appliance actually looks like. Let's also take a minute to introduce some quick facts about the appliance itself. It uses natural muscle and joint movements to open up the airway. It fits just like an orthodontic retainer. It's easy to travel with, sleep with, and clean. It's also been verified as an effective replacement for CPAP therapy in certain cases of obstructive sleep apnea. Now that you've seen what the appliance looks like, shown here in this larger image, let's take a look at how it actually works. It uses the patient's muscle and joint flexibility to pull the mandible forward comfortably so that the patient's airway can open up. This allows them more comfort than a CPAP, and they can sleep in almost any position that they want to. Now we're going to take a look at a CBCT scan of a patient diagnosed with obstructive sleep apnea. You'll notice here that the airway is quite narrow, and we were confident that this patient could benefit from an oral sleep appliance. Now we're going to take a look at the results. Notice how much the airway has grown in diameter just by placing an oral sleep appliance in their mouth. The widened airway can also help a CPAP machine work more effectively for those patients using both the appliance and CPAP for their treatment. Now we're going to talk about the types of patients you should send to our office. The first group are the patients who are unwilling or unable to use CPAP. Second group are the patients who still need improvement in their AHI with CPAP use. The third are patients with mild to moderate obstructive sleep apnea who would prefer an oral sleep appliance. Now you may be wondering what happens in our office. Well, what we do is a comprehensive initial examination, a CBCT scan to image the airway, and from that, we determine if they are a good candidate for an oral sleep appliance. It is also important to remember that a referral note, as well as a recent completed sleep study, are required for the patient to have before we take the next steps in treatment by making them a sleep appliance. If you have any additional questions regarding treatment or referrals, please call our Latham office or email us. Our office will also call insurance providers to see if a patient has coverage benefits for this treatment. Thank you for watching, and we hope to hear from you soon.